Hello, I'd like to welcome you to the University of Missouri Spine Fellowship. My name is Ted Choma, and I'm orthopedic spine surgeon here and the director of the Spine Fellowship. Normally, during interview season, we'll have our fellow candidates come out and have dinner with us on a Friday night and interview with us on Saturday and have an opportunity to tour our facilities. But obviously, during COVID-19 restrictions, we can't do that. And so I offer you this short video as a way of trying to get to know us and what we have here. I know that our Spine Fellowship applicants are all engaged in the national match and will likely have interviews at multiple places. So one of the questions that you'll have to ask yourself is, why would I want to train at Mizzou? And I think there are a few reasons why you would answer that. One is that we have beautiful and modern facilities that we practice in. They have allowed us to be very efficient, and it makes the practice more fun. In addition, we have a very robust set of research projects and research infrastructure in place that allows us to engage in and produce impactful research. I think the training experience here is highly regarded, and rightly so. I think the exposure is broad, and all of our previous fellows have been quite happy with the experience. I think you would also find that our department culture attracts some of the best faculty and staff in the country, and that adds immeasurably to your satisfaction during the fellowship year while you're working with us. And we treat our fellow like a junior partner, and I think that comes through if you get to meet us, and certainly is borne out by our previous fellows. And then finally, Columbia is a great location to live. It's a place that has a lot to offer and can make your stay here for the year that much more enjoyable. So how about first talk about facilities? This is a night shot of the Missouri Orthopedic Institute, which is a separate orthopedic hospital that we have built here on the main campus, about literally 300 meters away from the main university hospital. And this was a couple of winters ago. We don't usually get this much snow, but it made for a pretty picture, and I thought I would share it with you. This is a view from the other side of the Missouri Orthopedic Institute, and it is a fairly robust place where we have all of the elements to take care of our patients, minus ICUs. So for our spine patients who we anticipate requiring ICUs, we'll do those surgeries over at the main university hospital. But all of our other surgeries, our outpatient clinics, our offices are all contained within this building. It's quite large, about 200,000 square feet, and has now 12 operating rooms, 70 clinic exam rooms. It has 40 private inpatient rooms, all of the imaging services that we need, to include a CT scanner, 2 MRIs, fluoro rooms for injections, and full-length EOS imaging for full-length films. We have physical and occupational therapy here, both inpatient and outpatient. We have a pharmacy, a cafe, valet parking for our outpatients in non-COVID times. And the fourth floor are offices for the faculty, residents, and fellows and staff, as well as for the Thompson Research Lab, which makes research meetings and the ability to continue to keep pushing research projects forward that much easier. As I mentioned, the main university hospital is about 300 meters away on the same campus, and it is the only level 1 trauma center in the mid-Missouri region. It last year, I think, had about 100,000 emergency and trauma center visits. This picture on the top is of the newer surgical tower that opened up in 2013. It has 90 private patient rooms as well as 12 large operating rooms. This is where, if we're doing spine over at the main university hospital, this is where we usually are doing that. And so it makes it quite enjoyable to be able to walk only 300 meters and see the inpatient consults for tumors or infections or the trauma patients that come in and we take care of. Probably, I would argue, the main reason that someone would want to come and train with us for the year is our personnel. And we have 4 full-time spine surgeons. Myself, I have some administrative jobs as the department vice chair and currently as the chairman of our university physicians practice plan. Don Moore came to us from Cleveland Clinic after several years in practice, and has a full variety of procedures that he performs. He probably prefers some of the O-lifts more than I prefer A-lifts, but we both do much of the same work. Zain Mirza came to us last year out of fellowship and has the full tool set. And Faisal Mesfin has been with the university for a few years as a board-certified neurosurgeon, but recently made the transition full-time into our department. And so our fellows will spend equal amounts of time with any of the 4 of us. And Faisal's been a great addition to the fellowship experience to give them the opportunity to do some intradural tumor work, as well as the rest of the spine work that we all do. But in addition to our spine surgeons, we have a comprehensive spine center here at the MOI, which includes physiatrists who offer the full gamut of non-operative modalities. So Mark Dromowski, Maureen Iqbal, who was actually trained as an anesthesiologist and did her fellowship with a physiatrist, Krista McClellan, Ebby Varghese, will perform diagnostic tests. Krista's probably our EMG stud. Any of them will perform directed spinal injections for treatment or for diagnostic purposes. And so we operate in clinic right next to them, and we're constantly trading patients back and forth, and it's a very collaborative environment. In addition to that, we have a weekly spine conference that includes our non-operative spine colleagues as well as our musculoskeletal radiologists. It also will, from time to time, include the neurosurgery residents as well as many of our therapists. One of the things that I'm quite proud of is our AO Spine designation for the last several years. This is a competitive designation that is applied for by usually somewhere around 70 or so programs from across North America, and the top 35 programs are granted this designation. It, I think, demonstrates our dedication to teaching and clinical care and research. It demonstrates our commitment to the fellowship year experience. It also means that we commit to sending our fellows to the AO Spine cadaver course in the fall, as well as to the AO Spine research forum in the spring. We participate in online journal clubs and webinars throughout the year with these other centers, and there are many augmented materials such as the top 100 spine articles, which are sent to all the fellows as well. I can tell you that of all of the professional societies that I belong to, this has been the most rewarding, and these are just a few pictures of some of my close colleagues from across North America from other AO Spine sites. I've mentioned research support a few times in this presentation, and it is quite robust. The spine division currently has somewhere in the vicinity of a dozen clinical prospective trials ongoing. We have several retrospective studies that we are doing. We also have a ongoing examination of disc tissue that we excise during interbody fusions or microdiscectomies. And we've been doing a series of experiments to analyze the cytokine and chemokine profiles of degenerated discs in an attempt to help understand disc degeneration itself, as well as the development of degenerative instabilities and deformities. We currently have over 300 patients' tissues that we've analyzed, and I would expect that this project will continue to go on for quite some time. We have PhDs and graduate students who are involved in the running of these studies. And in the lower picture here, you see a representative picture of our research support staff. These include PhD biologists, veterinarian who runs the research lab, PhD statistician, as well as various undergraduate and graduate students and postdocs. The fact that these people are all here focused on helping us promote our research makes us much more effective than if we were trying to do these on our own. And I can attest to the fact that it allows the fellow to get meaningful research done even in the course of one short year. The upper picture here is a photo of one of our biomechanics robots that allows us to do mechanical testing on specimens that we've used in the past. And then the one other thing that I wanted to mention was what it's like to live here in Columbia, Missouri. This is a classic Midwestern college town. This picture above is of the spire at Jesse Hall, which is the main central administrative building. And then the lower picture is an evening shot of the downtown Broadway. The town is about 125,000 people plus an additional 50,000 college students. And as you might imagine, that means that we have lots of affordable housing, a pretty vibrant arts, outdoor recreation scene, as well as SEC sports, and lots of restaurants, shops, and nightlife. The trail system is one of the things that I think is a hidden gem here. The 225-mile long Katy Trail State Park is actually a reclaimed railroad that roughly follows the Missouri River across the entire state. It's great for biking or running or walking or hiking. There are tons of national forest lands around us, and so if you like outdoors things, there are lots of opportunities for you throughout the four seasons. The top photo here is a picture of one of the main quads in the summertime. As you can see, it's quite beautiful, and in fact, the entire campus has been designated a botanic garden. There are art and archaeology museums here that run by the university. There's an anthropology museum. There are concert series run by the university. Obviously we're part of the SEC, and so this is college sports at the highest level in not just football and basketball, but all college sports. And so there are a lot of things that you can do here that will add to the enjoyment while you're here for the year. So I'd like to thank you for your attention during this brief video. This is another picture of the columns that are here on one of the quads in the summertime. I apologize that we couldn't have in-person on-site interviews this year. I'm looking forward to when we can do that again. And I'll look forward to interviewing the fellowship candidates via Zoom in the coming weeks. Thanks again. Take care.